The Quality Assurance and Capacity Building Unit oversees the annual quality assessment visits to over 650 childcare centres across Toronto. We would like to share with you Children's Services Revised Assessment Measure, the Assessment for Quality Improvement, and review the expectations and processes related to the measure. The Assessment for Quality Improvement, or AQI, prescribes clear expectations, service standards, and guidelines for all childcare providers who have a service contract with the city. It also serves as a self-evaluation and planning tool for childcare operators and educators. Parents have an expectation that a licensed childcare centre will deliver a high-quality program that provides opportunities for play, socialization, exploration, and developmentally appropriate learning, all in a safe and nurturing environment. The assessment measure uses the program, environment, and interactions collaboratively to provide quality childcare to Toronto's families. It is important that agencies and their boards of directors understand that the AQI can be used as a resource tool to support continuous improvement and set strategic priorities for your organization. The tool is much more than just an annual accountability measure. This can be achieved through self-assessment and peer assessment within the childcare centre. The measure can be used as a resource during room meetings to review expectations and encourage the sharing of ideas.
We have team meetings, they review the tool, they look at all the areas in the program that they have the necessary materials and equipment, and they plan goals based on the self-assessment that they do. It really helps the staff because it gives clear standards and expectations of the program and how to achieve goals, as is clearly stated in the tool.
The assessment measure encourages a team approach to improve the quality of services. We recognize that educators want to excel in all areas, and this can be an added stress. You should remember, achieving a rating of 3 is completely acceptable. This goal-setting strategy will also assist you in financial planning and budgeting for the centre by identifying areas that require improvement. This can help you plan for these additional expenses. For example, one of the new expectations is having a child-sized sink accessible in the playroom. As an organization, you may determine that you can't afford to install a sink in 2014 or 2015. However, knowing that this is something you would eventually like to do, you might want to plan for it in 2017. A Quality Assurance Analyst, or QAA, will conduct each annual assessment. These visits are unannounced and the timing is random. Once the assessment is complete, the QAA will meet with the centre supervisor or designate and provide feedback. If there are areas where minimum requirements were not met, the QAA will inform the supervisor, who will need to develop an action plan to make improvements. The QAA's assessment is submitted to the centre's district consultant, who will follow up. To ensure that QAAs are using the assessment measure correctly, we have a testing process called the Inter-Rater Reliability. QAAs must achieve a minimum of 80% and are tested for reliability at least 3 times a year. In 2008, Children's Services started publishing the quality ratings on the web page. This step provided families with more information when determining their childcare choice. Operators and boards of directors are able to use the ratings as a marketing tool. Posting the ratings has led to an increase in the number of centres meeting minimum requirements. Before, approximately 67% of centres met minimum requirements. After publishing the ratings, the number of centres meeting minimum requirements increased to over 90%. In addition to supporting families to make informed decisions related to their childcare, Children's Services needs to be accountable for tax dollars used in the childcare system. The Quality Assurance Measure is one way to achieve this goal and ensure we are funding high-quality early learning programs. With the revised assessment moving from a 4 to a 5-point measurement scale, it's important to remember that there may be an impact on the centre's final ratings compared to previous years. Due to the raised expectations in the revised assessment measure, the centre's ratings may be lower, and it is unfair to compare previous year's assessment outcomes as it is a different measure. To ensure the public is aware of the differences, we have updated the Children's Services website to educate families about the revised measure and quality expectations. Each centre that has an annual assessment receives a Quality Makes a Difference sticker to display in their center. The sticker assures families that the center participates in an annual assessment process and acknowledges the hard work and dedication of the staff. Quality does make a difference. Together, we can ensure that high-quality early learning programs are available to families across Toronto. If you have any further questions about the assessment for quality improvement, please contact your center's district consultant.